Steve. Madam Speaker, it's a great privilege to be here on the floor with you, and congratulations to you and the other new members of the Republican Party. We have some extraordinarily important tasks out ahead of us. This afternoon I'm going to be joined by my colleagues, and with the consent of the House, I'd like to enter into a colloquy with them, and so I request that without objection. Without objection, so ordered. Thank you. We just heard a very useful discussion on the role of the Constitution and how it plays into it, and indeed today we did spend actually about 3 hours reading through the Constitution. I think it was to all of our benefit. We started off with the new speaker actually reading the preamble. And I think that's a good place for us to start, because we're going to discuss health care today, and we're going to discuss an effort by the majority party, the Republicans, to repeal the Affordable Health Care Act that was passed last session. In that, and this issue has become a constitutional issue, so reading the preamble to the Constitution and Section 1, Article 8, it's useful. We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution of the United States. And then later in Article 1, Section 8, Congress shall have the power to lay and collect taxes, duties, imposts, and excises, to pay the debts and provide for the common defense and general welfare of the United States. It's about the general welfare of the United States that we'll be discussing in this next hour, and that's the welfare of the people of the United States. It speaks to us, the citizens, all of us, whether we are a newborn baby or a senior in the last of life. How do we provide for that general welfare? Last year, in a major step forward, the first time in nearly 4 decades, this Congress, together with the Senate and the President, passed the Affordable Health Care Act. A very, very important and extremely useful step in providing for the welfare, that is, the general welfare of the American population. It's a law that makes life better from birth to retirement. Part of this law, a very, very important part of it, deals with what we call the Patient's Bill of Rights. The Patient's Bill of Rights vis-a-vis the insurance industry. I think all of us can go back to our districts, to our homes, and even to our own lives and find numerous episodes where the insurance industry has said, no, you cannot have this procedure, or no, you cannot have coverage because you have a pre-existing condition. Today we're going to talk about the Patient's Bill of Rights and the Republican effort that is now underway in Rules Committee in this building as we speak to write a rule that will bring to the floor next week without one hearing to completely wipe out this extraordinarily important effort to provide for the general welfare of the American people. We're going to discuss that in great detail. Now, for me, this is a very important part of my life. I spent 8 years of my life as the insurance commissioner in California, taking on the insurance companies, trying to force them to honor their commitments, to force the insurance companies to pay the claim of a patient who had undergone chemotherapy, to provide insurance that was contracted for and not to rescind that health care policy. I cannot even begin to count the number of cases that came before me as insurance commissioner where the insurance companies would rescind a policy because the person suddenly became ill and had a very expensive episode. The Patient's Bill of Rights prohibits that. We're going to talk about that. I want to start here, and then I'm going to turn this over to my colleagues. I'm going to give an example of a very dear friend who lived here in Washington. He was a Peace Corps volunteer, married, was working here in Washington, D.C. as the director of the National Peace Corps Association, the Returned Volunteers, had a child. That child had a severe disability. Kidneys didn't work. He was insured. His wife was insured. The pregnancy was insured. The delivery was insured. But that child, on the day the child was born with that pre-existing condition of kidney failure, was uninsurable under the parent's policy. That kind of action is prohibited by the Patient's Bill of Rights. No more would that happen. Men and women, families, pregnant women across this country that deliver a baby that has some problem, that baby will be insured, whatever the condition might be. Our colleagues on the Republican side will bring to this floor next Wednesday, without one hearing in any relevant policy committee, a repeal of the Patient's Bill of Rights. And what of the babies that are born in the future that have some issue? How will they be provided for? The rest of the story is this family has spent 20 years now struggling to provide the health care services that their child needed. They have been close to bankruptcy many, many times. They've struggled through it. The child is no longer a child, a young adult. And under the law today, he has health insurance. Is that what the American public wants from the Republican Party, the repeal of that Bill of Rights that guarantees coverage for that young man? I think not. Let me now turn to our colleague from the great state of Virginia. Bobby Scott, would you please share with us your own views and how this is going to affect the general welfare of the American people?
Thank you. And